Good morning, everyone. Thanks, RSNA, for the introduction and the invitation. I'll be talking about building a better future for the global radiology community, selfless service, innovative technologies, and online radiology education for COVID-19 and beyond. Let's start with this message of hope. We have had a tough year, but we are tougher. There are times when we felt broken, but we will put the pieces together and rebuild. We choose courage, we choose hope. We stand on the shoulders of those who came before us. We will build a better future for ourselves and those who follow us together. Now let's watch this 2-minute video from radiologists around the world.
My name is Dr. Mrs. Glenam Jeffy Tete. I'm a consultant radiologist and the head of radiology department at the Kolebu Teaching Hospital, Accra, Ghana.
My name is Juan Pablo Valle. I am a radiologist and also a neuroradiologist. I am working in Ibagué. It's a small town close to the capital.
Amal Saleh, and I'm from Ethiopia.
I'm Dr. Dichin Niduk, radiologist from the Kingdom of Bhutan.
Lena Lambert, and I'm from Zambia.
My name is Sarah Shimbi. I'm a third-year resident in radiology.
I'm Dr. Rashmi Saraf. I'm consultant interventional neuroradiologist at St. J.S. Medical College and KM Hospital in Mumbai, India.
Dr. Sahari.
Jaime Conde Vargas. Soy médico radiólogo de la Caja Nacional de Salud de la Seguridad Social.
En la carrera de radiología de la Universidad Central del Ecuador.
Samai Nukundo. I'm a Rwandan national and I'm doing my interventional radiology training.
Guillermo Lizondo Riojas. I am a radiologist. I'm working in the University Hospital in Monterrey, Mexico.
Dr. Irama Andam Aidan. I'm a medical doctor and a radiologist. I'm working at 37 Military Hospital in Accra, Ghana.
So how do we build a better future for radiology during COVID-19 and beyond? These are the 4 pillars which are based on my lessons in global health for the last 20 years. Number 1, selfless service. Number 2, education across the globe. Number 3, technology innovation. And number 4, power of global radiology community. Let's start with the number 1, which is very close to my heart. This is a picture of my grandfather's village in India. And these are the mustard fields which were outside the village. As soon as I saw these, I knew that I was getting close to his home. This is a picture of my grandfather, and this is what he said. In sickness or in health, in good or bad times, always do good for others. Seva, or selfless service, gives deeper meaning to life. I can still hear those words in my ears right now. My grandfather was the nicest guy. He used to have a bicycle, which he used to use to go around and check on the well-being of the villagers. Everybody loved him in the village. Unfortunately, when he had a stroke, he lost function on one side of his body due to hemiplegia and lost his speech due to aphasia. During this time, he was a warrior, but he did not have access to doctors, physical therapists, or speech therapists in the village. And that made me realize the pain and suffering which can arise due to lack of health access. Years later, that led to formation of Health for the World and my journey in global health. I was very lucky to have very encouraging parents who instilled the value of seva in me, but also encouraged the global health work which I was doing. I grew up in India. I did my medical school in India. Then I moved here. I did my radiology residency at University of Cincinnati and neuroradiology fellowship at Massachusetts General Hospital at Harvard Medical School. I started as a neuroradiology faculty at UCSF and co-founded Health for the World in 2016 with Dr. Bill Dillon and Dr. Ankur Parija. Dr. Bill Dillon is the Executive Vice Chair of Radiology at UCSF, and Dr. Parija is at Stanford. We started Health for the World. So what is Health for the World? Health for the World is a global health movement. It has been working in 110 countries, promoting health using free of cost medical education and technology solutions. Above all, it's a completely volunteer-driven movement. The educational outreach has been in 110 countries, and we aim to keep growing every day. I'm grateful for the recognition of the global health work. I'm particularly thankful to RSNA for supporting the work through RSNA Education Scholar Grant in 2015 for our work in Kenya. I'm also grateful for all the media outlets which covered our work and amplified the impact of their work. During these journeys, like all of us, I've had obstacles and failures. I particularly remember when I moved to US, I was a foreign medical graduate, and I was applying to multiple radiology residency programs. I'm glad I did not give up. Today, Health for the World is working with doctors, patients, and radiologists around the world. As you might know, that women CEOs are rare. I would encourage everyone to follow their dreams and not to get discouraged by the obstacles and challenges in life, which are often humbling. I'm particularly grateful for my family, my friends and mentors. Ankur, who's my husband, and my daughter Tara. Also Dr. Bill Dillon, who is a co-founder and has helped us in every single step of Health for the World. And all my mentors who have always supported me in my journey. So I talked about the selfless service. The selfless service is an important part of what we do. It lays the foundation of all the global health work and is an important pillar for building a better future. Now let's move on to education across the globe. What is the challenge which we are facing? We want to design a sustainable solution in global health and radiology. World Health Organization estimates that more than half of the world has little or no radiology. I took some time off and I traveled around the world. I listened to stories of radiologists and doctors from around the world, and there was a common lesson. The lesson was need for education, need for training. Let's dig deeper into this. Let's look at Africa, population of 1.3 billion. There are countries like Chad, which do not have even one radiology residency program. There are countries like Rwanda and Zambia, which have one radiology residency program serving millions of people. Here we have pictures of the smiling faces of radiology residents of the first radiology residency training program in Zambia. We did surveys and we found only 15%, that is 2 out of 13 countries, offered subspecialty training in Africa. So you can imagine training in these countries with residency and fellowship programs can impact the lives of millions of people. Moving on to Latin America, population of 655 million. From our surveys, we found 60% of the radiologists expressed need for more subspecialty training. Again, doing subspecialty training can affect lives of millions in South America. Moving on to Asia, population of 4.5 billion. 5 countries among the surveyed 19 countries had little or no subspecialty training, again emphasizing the need for training. Now moving to a beautiful country, USA, country of 328 million people. There are rural parts of USA, including Navajo Nation, which struggled deeply during COVID-19. And that is where I want to pause and take a second. Global health is not about helping people outside US. It is also helping people within US, especially in the rural areas. It is helping all the humanity in need. This is a nice article from New England Journal of Medicine which talks more in detail about this. Our global health research has been published in JACR and can be an important reference for those people who are interested in global health. Our surveys of 80 countries demonstrated huge need for subspecialty training in radiology worldwide. This is a beautiful quotation by Nelson Mandela. Education is the most powerful weapon which you can use to change the world. So when we did the surveys of 80 countries, we realized that there's a huge need for education, and we do not have time to go to 210 countries and educate for years and leave our medical careers here in the US. So what is the solution? So we decided to start online education, which would be live telecast to different countries. But they were challenges like everything in life. The biggest challenge was low bandwidth internet for live teaching. The other challenges included language differences, time differences, coordinating with the speakers nationwide, and designing a curriculum with outcome metrics. So we started in 2015 with Kenya at University of Nairobi, and I still remember this day. It took us a month to set up the web platform, which was optimized for low internet settings. And finally, when it worked, and this lecture of stroke imaging, which I was giving here in San Francisco, was transmitted to the radiology residents at University of Nairobi in Kenya, everybody beamed with happiness. And after that, there was no turning back. In 2016, we started training in Thailand. This is a picture of Dr. Bill Dillon at UCSF giving a talk on intracranial hypotension. And here are the radiology residents at King Chulalongkorn Red Cross Hospital in Thailand. I was actually at Thailand during this time, and I could see the excitement after the lecture. In 2016, we faced another challenge. We started working in Tena, Ecuador. And the question became, can we connect to a town in Ecuador's Amazon forest with reliable video conferencing? And the bigger challenge was that how do we train in Spanish? Because the doctors only spoke Spanish. The International Radiology Foundation brought this problem to our attention. This was a children's hospital. They had a CT scanner and an MRI scanner, but no radiologists to read the images. So Dr. Mauricio Castillo took leadership in designing a Spanish curriculum, which included multiple aspects of neuroradiology. And these are different pictures of the teaching which happened in Tena, Ecuador at this hospital. I still remember this WhatsApp message. After one of the lectures on MR imaging in epilepsy, they were able to diagnose their first case of mesial temporal sclerosis in a child with seizures, and they were so excited. This is one of the best examples of impact of education. That child had the diagnosis because of the online education. I soon learned that it's important to also focus on other specialties. I'll give you a practical example. If you train neuroradiologists or radiologists on imaging of brain tumors, but you have to also think about training in neurosurgery and radiation oncology about how to actually treat these tumors. So that is where the multidisciplinary education comes into picture. So in 2017, we started training at Mingo Baptist Hospital in rural Cameroon with multidisciplinary weekly education. This is one of the snapshots of one of these trainings. Here we have Dr. Tariq Al-Sayed at Cincinnati Children's Hospital. And here we have the internal medicine residents in rural Cameroon. They do not have subspecialized education, and they were taking care of 2 babies with congenital heart disease. They were not trained as pediatric cardiologists. So they took help from Dr. Tariq Al-Sayed. Dr. Tariq Al-Sayed systematically went through the management for these 2 babies with congenital heart disease, and the residents listened carefully and took the required steps. And luckily, both these babies were discharged from the hospital. So again, a beautiful, beautiful example of the impact of online education and helping our colleagues worldwide. In 2017, we started training at Muhimbili University in collaboration with Dr. Mocha Jacob, at University of Rwanda in collaboration with Professor JJ and Ivan Rukundo. In 2019, we also started working with Dr. Klinam Zefiteti, who you also saw in the video, and we have been training there weekly since then. And in 2020 in Zambia. So I also would like to pause and just talk about an example here. In Zambia residency faced a challenge during COVID-19. We stepped in and helped up with the online education. Usually the online education is at 7 a.m. California time so that multiple continents can join in. However, there was one online education session which was at 5 p.m. California time, which is 2 a.m. Zambia time. But the residents stayed up at 2 a.m. to listen to the lecture. So you can understand the depth of passion to learn by the residents, which is really inspiring. These are pictures of virtual classrooms for different countries around the world. So we were doing this for 5 years, and then COVID-19 hit us. The classroom education around the world stopped. Multiple countries where we worked did not have the infrastructure to design their own online education curriculum. And then the question began, how do we train the residents during this time? And that is when the online education helped. We scaled our online education efforts, and in 2020, the weekly radiology education live telecast was telecast to 110 countries around the world. We also telecast the COVID-19 Education Center, which was multidisciplinary, and we'll talk about it a little bit later. So what is the power and the vision of global education in radiology? Ideally, every physician will have access to free, reliable online education, no matter which part of the world they live in. And for that, we have to work together as a global radiology family. All right, let's talk about a third pillar, technology innovation. So these are different kinds of technologies which can be used in global health, and I would like to share some lessons which I've learned in this journey. The first is learning management system, second is mobile health, third is virtual reality, and fourth is artificial intelligence. So I wanted to talk about my journey in online asynchronous education for global radiology education. So once we started this virtual online classrooms, it was very clear that many countries could not join because of time differences. And then it was clear that we had to build a learning management system so trainees around the world could access education at their own time. So how to make an online learning medical education platform in radiology impactful? So these are some features which I have found really helpful. Number one, it should be free of cost so that anybody in the world can access it. Number two, the quizzes and the performance metrics. Those really help because that provides feedback in areas of learning. Number three, discussion forums, because those are interactive and people can discuss the questions and answers. Number four, online certificates, because that provides encouragement when the trainees are done with their courses. And finally, multiple languages, because it's really important for the educational content to be understandable and culturally sensitive. So as I talked before, we built a multidisciplinary curriculum in 15 specialties. And this is a video of the Health for the World Academy website, which houses all the lectures and different medical specialties, including radiology. So if you click on the radiology icon, you can access close to 100 lectures in radiology. I also learned that in Africa, because of low internet settings, even having a learning management system might not help, because during the power cuts or otherwise, they might not be able to access the learning management system. So that is where YouTube is helpful. So we uploaded all the lectures on the YouTube channel. The good thing about YouTube is they could download the YouTube app, and then they could access the lectures on their own time. They could also download the videos itself, so that if they go to an area where there is no internet, they could still watch the videos. Another good thing about YouTube is the auto-translate feature. So here's a video of imaging of oral cavity cancer. And as you can see, you can switch on the subtitles, and you can activate the auto-translate feature and translate the subtitles into hundreds of languages, which is really useful in the different countries where we work in. I'm very grateful for faculty from more than 25 academic institutions who volunteer to teach through this program. So let us just talk about the impact of both the synchronous and asynchronous online education. We talked about the 110 countries. We studied the performance improvement with pre and post-test quiz, and the score improvement was 70% before and after the lecture. There are more than 500 training videos on YouTube. There are more than 150 leading speakers from top US academic institutions who have volunteered to teach, and there have been more than 250 live workshops worldwide. So we talked about education. Let's move on to mobile health. So this is the Health for the World stroke app, and it's one of the good examples of how mobile health can be useful in global health. So let's look at this app a little bit more carefully. There are multiple animated videos which can be used by patients. What was the inspiration behind this? So in the beginning, I talked about my grandfather's journey with stroke. The aim of the app was to help patients around the world who are suffering from stroke, who do not have access to doctors, physical therapists, or speech therapists. The aim of the app was that if the neurologists or the doctors in the cities prescribe the app, the patients can go back to the villages and can still do the exercises. Let's look at this in detail. Here is her Help Me Speak section, which acts like a speech machine if the patient has lost their voice. The most favorite button for all the patients is this button right there, which is a heart button which says, I love you. Patients around the world have used this app to communicate with their families, especially after aphasia. There's a reminder section, there's an education section, and an exercise section. And this has been translated in multiple languages to help patients with stroke. Here's a picture of a stroke patient who lost his voice because of aphasia in rural Cameroon. Here is the internal medicine resident prescribing the app, and he used the speech machine to communicate with his family after he suffered from a stroke. So mobile health is very powerful in global health. So what is the future? Number one, to help patients in areas of low access globally. Secondly, humanitarian teleradiology to access images on mobile. We have used that in multiple countries, and this can be an extremely useful tool. Number three, global radiology education to spread education more widely. Now let's move on to virtual reality, which is another technology which can be useful in global health. So let's talk about role of virtual reality in global radiology education. So this is one of our research papers which talks about how to create 3D models in radiology for education. The aim of the virtual reality is to make the education next generation and more immersive and interesting. So right here, we have a 3D model of circle of Willis in the brain. The arteries of the brain are labeled, as you can see, and you can easily interact with the model with a VR headset. Here is Dr. Dillon wearing the VR headset. You can also project the 3D model in an AR mode in a room and interact with the model to make it more immersive. One important learning point here is that you do not require a VR headset to do the interaction. There are multiple apps now available where you can switch on the AR mode and help with the interaction. Now moving on to virtual reality in motor imagery. So this was used in the stroke app. And the aim was, let me give you an example here. Here we have a stroke patient in Nepal who was recovering from stroke and still does not have function in one of her legs. She's doing the VR exercises to stimulate the motor cortex of the brain using motor imagery. And that has been shown to be helpful in recovery. So we talked about how virtual reality can be useful in global health. There has been excellent research on virtual reality by a global radiology community. And here are some of the papers which can be a useful resource for those people who are interested in virtual reality. What is the future of virtual reality in global health? Number one, education, to make it more immersive and exciting. Number two, improved patient interaction, as we discussed in the app. And finally, guiding surgical care and IR procedures, which some of our radiologists have done. Now let's move on to the role of ML and AI in global health. I really believe there's a big role here, and there's a reason why. Now imagine a place in the world which is a remote corner of the world. There are no doctors, no physical therapists, no nurses. That is where the power of artificial intelligence and machine learning comes in. There can be chatbots which can really help. And let me give you a practical example of that to show how this can be useful. So let's first talk about AI-based chatbots. Chatbots provide support to healthcare workers in rural areas and the low and middle income countries with decision tree and algorithmic systematic approach. The natural language understanding platform can be used. So this particular chatbot is to train a healthcare worker in a village who's not trained in different specialties in medicine. He might not even have gone to medical school and might have just had some training for a few months in medicine. He has to take care of patients with abdomen pain, chest pain, headache, and he has to wear multiple hats. He really does not know which tests to order and which tests are done in the city. So this is where the chatbot helps him. This particular chatbot is a chatbot for headache. It specifically tells the healthcare worker what questions to ask the patient. And based on the responses with an algorithmic approach, lets the healthcare worker know what tests to order, what differentials to consider, and what should be the management plan. So this is an excellent tool which can be there with the healthcare worker 24/7, 365 days. And this is on the Academy website. The chatbots can also be used for patient support. In the very beginning of AI, I talked about imagining an area of the world where there are no doctors. So this is a machine learning based chatbot in Health for the World Stroke app, which educates the patient about how to recover after stroke, how to prevent a second stroke, and it helps them in their journey after stroke. This chatbot is in the app and is with the patients 365 days, and it can be useful. The important thing about the app is it could be downloaded in an area of internet, and it can be used in an area in a village without internet. So again, it shows the power of support and education of the patients also in the areas of the world where there are no doctors. Another really amazing application for AI is AI-based recommendation algorithms. The recommendation algorithms suggest related courses based on the courses previously watched. So similar algorithms such as collaborative filtering has been used by Netflix and Amazon. So when you see a movie on Netflix and you really like it, Netflix recommends the next movie which you can watch. Similarly, if you do a course, this is a picture of the Health for the World Academy website. If you do a course on CT and MRI of head and neck spaces, you'll get a recommendation for the related course which you can do for head and neck imaging. So the related course helps the students understand what could be the next course which could be helpful in their learning journey. Another good application is ML-based matching algorithms, which we have used to match the research mentees internationally with research mentors in US. So it can be really useful for matching people with similar backgrounds. Our radiology community has used ML in diagnosis of images, and this could be really helpful in places like Tena, where I talked about, in which there are no radiologists, for automatic detection. So what is the future? What is the future of ML in radiology and global health? Number one, automatic detection in areas of the world where radiologists are limited or don't exist. As we talked about, it can be really useful in places like Tena, Ecuador. Number two, personalized innovative radiology education models. All of us learn differently, and there are different education models available. What AI can do is it can personalize for you the education model the way you would like to learn. And number three, patient support and education globally. We talked about the chatbots and how they can be available in any part of the world, anytime. So what is the power of technology in global health? Technology can reach parts of the world where radiologists or physicians cannot, and it can stay and help people all the time, which is really powerful. And that is why all of us have to work together to design technology solutions in radiology and global health. All right, so let's talk about a final pillar, power of global radiology community and the spirit of volunteerism. I've been really impressed by how many radiologists who volunteer to teach through Health for the World and other avenues. Here are the pictures of close to 100 radiologists who volunteer to teach through Health for the World Academy. When we started, we were worried that radiologists are so busy and they won't have time to volunteer, but we were impressed with the passion to teach. And the teaching includes multiple subspecialties in radiology to have a more comprehensive curriculum. So I'm really grateful for the radiology community for their spirit of volunteerism and giving back through education. I'm also grateful for the Health for the World team members. As I said before, this is a completely volunteer-driven initiative. Our team members include radiologists, medical students, but also people outside medicine, people who have tech background, media background, who have taken out time to volunteer and give back. And these people inspire me every day. Apart from the volunteerism to teach, I also found that the radiology chapters was very effective to help with global health issues. The chapters are like powerhouses of faculty, residents, fellows, and medical students in academic institutions within US and abroad who work together to solve global health problems and to catalyze change. And I've been very impressed with so many people in radiology who have come up and who have created these chapters around the world. And these chapters are solving common problems in education, technology, and also COVID-19 related issues which we are facing currently right now. Here are some snapshots of the national and the international radiology community chapters who have stepped up to help out. I also want to emphasize that it wasn't just Health for the World, but multiple other radiology societies who really helped out with education during COVID-19. To just name a few, RSNA, APDR, ASNR, ASPNR, SPI, and many others decided to do completely free of cost and online education to help the radiology trainees around the world during COVID-19 and beyond. RSNA also created a COVID-19 education center to educate about COVID-19. There are also multiple global health efforts in radiology by the radiology community. Apart from the Health for the World, there is RSNA Global Learning Centers and CIRE. There are international outreach committees in radiology in both national and international societies. There are also global health sections in radiology departments worldwide and multiple other nonprofits which I mentioned here who are doing excellent work in global health. This is a question which I commonly get asked, how to get involved in global health in radiology. Number one is volunteering to teach online. You can just volunteer your time to teach online, which is a very effective way of giving back. Number two, you can mentor the international residents. There are residents who have very interesting projects, but who are looking for mentors. And the mentorship is a very powerful way to give back. Donating PPE through nonprofits, multiple nonprofits, including Health for the World, are donating PPE to protect our radiology colleagues around the world. And this is a very powerful way to help out and protect our colleagues and physicians around the world. Number four, working with us for tech solutions. This is a huge project and there's a lot to be done. So we can work together for tech solutions in global health. And finally, spreading hope. These are hard times for everyone. So in whatever way we can spread hope. So we talked about 4 pillars and how they can be used in building a better future. So let's just talk about how these 4 pillars were used during COVID-19. It's interesting, the lessons which you learn in your journey can sometimes help you during a pandemic. Like for example, let's just talk about these examples. So let's talk about the first pillar, education. Because of the lessons which we learned in the 5 years, we were able to scale our educational program to 110 countries and provide weekly radiology education. Number 2, technology. We'll be talking about 3D printing, which was used for PPE. Number 3, selfless service. We'll be talking about Letters for Hope, which the radiology community around the world participated in. And number 4, worldwide global radiology community. What are the challenges which were faced by radiologists around the world? Number 1 was safety. The radiologists were concerned about their own safety and the safety of their loved ones. They were also concerned about the safety of their patients. Shortage of PPE remained a big problem for safety of radiologists. Need for online education, we talked about that. Also, CT was used for diagnosis in parts of the world where there was no testing for COVID-19. Then finally, concerns about the future and uncertainty about the future. So let's talk about our education pillar. So during COVID-19, we started a COVID-19 education center. Our radiology community volunteered to teach. Chairs of different departments volunteered to talk about how their departments prepared during COVID-19 so important lessons can be learned. Apart from radiology, we had pediatricians who talked about COVID-19 affecting children, ICU physicians talking about ICU care, emergency room physicians talking about ER care, and palliative care physicians talking about palliative care. So it was very multidisciplinary. I wanted to show this video of how we utilized 3D printing to face the shortage of face shields. So we 3D printed these face shields and we sent them to multiple countries around the world. Here are pictures of PPE donations both in US and abroad in Philadelphia, Colorado, Uganda, Ethiopia, and Malawi to protect our frontline healthcare workers and radiologists during COVID-19 and to aid with PPE shortage. Another beautiful project which talks about how we can work together as a radiology community is Letters for Hope. Radiologists around the world sent online letters to nursing homes, hospices, and children's hospitals to spread hope during COVID-19. These are smiling faces of nursing home patients who received these letters of hope, letters for hope from radiologists, which was very heartwarming. So this is a beautiful quotation by Viktor Frankl. Let's watch this 2-minute video from a message from hope from radiologists around the world.
Be kind to one another, help each other, and work together.
Psychologists are coming in, the priests are coming in to encourage people to stop stigmatizing those who are infected with COVID-19 in Africa.
Life will change, life will happen, but it's up to us to adjust and to adapt progressively to whatever is happening.
Ce que j'aimerais plus, c'est que à chaque fois quand il y a des cas.
Coming to our profession as a doctor and as a radiologist, as everyone knows that radiology is the core of the hospital.
This pandemic was new for us, but we are doing the best for the healthcare of our patients.
The world today is different from the world 50 years ago, where social media was different, technology was different, so sharing knowledge required really to travel and go physically. But now the world has become like a village. You can just do a video right now and you can be followed by many people in Africa.
Overwhelmingly encouraging to see that people who are also struggling with their own COVID-related challenges would take time out during the busiest, most chaotic time in their lives to just sit with us and give us a lecture, to go through cases with us and to encourage us.
Un microorganismo causó y sigue causando tanta pena y dolor a lo largo del globo terráqueo. Debemos valorar mucho más a la familia, a nuestros amigos, el tiempo libre, ya que esos pequeños momentos de felicidad pues pueden sanar el alma, curar nuestras heridas.
See what the problems, our common problems are, and eventually we will realize that we have to work together. And that working together is the only way to have solutions.
I want us to encourage ourselves that we are in this together, and we are all, when we fight together, we'll be able to overcome this virus.
Thank you to the President of RSNA, Dr. Jim Boxton, RSNA Board. Finally, thank you for attending. Stay safe, and we will build a better future together.